Good morning to one and all. Today's topic is common tumors and miscellaneous lesions of the skin. I am not going to differentiate the benign tumor from malignant tumor. I already explained in the class very detailedly so many times. So I am directly going into the benign tumors. First one is a papilloma. It is a benign sessile or pedunculated tumor composed of squamous epithelium. It always a core of connective tissue element, contains blood tissues and lymphatics. Okay, it's mostly arises from the epidermis layer of the skin. It's mostly a cosmetic disfigurement. Okay, when you're having a two types of varieties, squamous cell papilloma and basal cell papilloma, when you have a proper surgical procedure to remove this, it won't again reoccur. Okay, then coming into the next one is adenoma. The name itself shows it arising from the glandular structures, but it does not have any kind of secretory function in this kind of benign tumors, but it mimics like a glandular one. Usually glands will have a secretion, but in case of adenoma there won't be any kind of secretion. It's the best example is a fibroadenoma of breast. It doesn't have any kind of secretion. Then cystadenoma of pancreas or ovary and kidney are same kind of disease patterns. Then coming into the fibroma, it mostly a hyperproliferation of the fibroblast. There are two varieties of fibroma, hard fibroma and soft fibroma. The hard fibroma which occurs in the bones, especially the long bones, femurs and hip bones, we can able to find the fibroma. The soft fibromas are mostly seen in the oral cavity, in near the gums. Then coming into the myoma, myoma is nothing but the muscular tumor. Is rhabdomyoma is one of the tumor of the striated muscle. Leiomyoma is one of the smooth muscle tumor. The uterus, stomach, intestine, skin layers, you can able to see the benign tumor of this muscle. So especially the benign tumor of muscle is called as myoma. Then all these kind of benign tumors will have a common treatment, excision. It's depending upon the size and site of tumor, incision has been made and removed. Okay, then coming into the lipoma. Lipoma is also called as a universal tumor or ubiquitous tumor because wherever the fat cells are there, there is a possibility of getting changed into a benign one. Lipoma can occur anywhere in the body except brain, where the fat cells are not able to be seen. Okay, there are different varieties of lipoma, the encapsulated, diffuse and multiple. In that encapsulated variety, it comprises about 60% of cases. It occurs at any age, mostly affects the back, trunk of the body. Painless swellings, 90% of cases. Then coming into diffuse lipoma, mostly subcutaneous level, you can able to see the diffuse lipoma. It does not possess any capsule, but in case of first one, you can able to clearly see a capsulated one, encapsulated variety. This diffuse lipoma is mostly seen in the those persons are alcoholic because of the excessive energy that cannot be utilized immediately. So the stored form of fat is getting increased day by day. Then coming into the multiple lipoma, this is a small numerous like fat storages occurs in all over the body, and this mostly affects the nerves, so it is mostly painful. Okay, nervolipoma. Then I have mentioned some of the other various varieties of lipoma depending upon the anatomical situations, subcutaneous or intra-articular, subfacial, subsynovial, intermuscular, parasteal, everything I mentioned here. Depending upon the site, they gave the name. This slip sign is positive. You cannot be able to hold the swelling. That is a more characteristic finding of lipoma. When you hold the swelling of lipoma, it slips in between the fingers. We cannot hold that finger for a long time period because it's a fat, trans fat, highly refractile fat. So it's getting slipping. Then coming into the complications, maximatous change, saponification, calcification, then sarcomatous changes, that is malignant transformation occurs in 1 or 2% of cases. Then surgical management, removal of the tumor, that is excision of the tumor with a proper anesthesia. Up to this, we have completed the part 1 of common tumors. Remaining will continue.